What's going on, everybody? This is Julien Stoutt, licensed personal trainer, licensed PE teacher, world record powerlifter, and special education teacher, here to take the fear out of fitness. This video is a very sad one to do because a very famous person who was also the mother of 3 children lost her life while under the knife on the 31st of May. And the problem is that what we're going to talk about today is not necessarily Miss Jacky O herself, although Miss Jacky O's situation has a lot for us to learn from. And one of the things that I've been a big, huge commentator on is the BBL and why it is not good to do this. According to reports, Jacky O was going to, first of all, shout out to DC Youngfly and his 3 children. My condolences, my deepest condolences, because I dread being in your position. However, if this situation is going to change the attitudes and minds of women across this country, if not the world, about how they should love their bodies in a particular way that will benefit them the most, this is the show for you. To the 8 women that actually watch my program, and to the 149 men that watch this channel, please show your significant others this video, because this is the exact reason why I do what I do. Not only on this channel, but outside in real life, I help people change their bodies for the better and give them the information that they need in order to be the best versions of themselves that they could possibly be. It has been reported that Miss Jacky O has passed away while under the knife because she was going to do a mommy makeover. And what most people don't know is a mommy makeover. What is a mommy makeover? I'm going to look that up real quick for you. Okay, according to Google, what are mommy makeover procedure options? Because pregnancy and childbirth have significant impact on the breast and body. Mommy makeovers tend to include breast enhancement, i.e. breast augmentation and or breast lift, and body contouring surgery, i.e. tummy tuck and liposuction. All right. There's rumors that BBLs are also included. However, in this situation, I understand that Miss Jacky O is a woman who is on television on a regular basis, and as a result, the use of her beauty is paramount to her success. However, I was unaware that she was a mother of 3 kids, number one. Number two, considering that no one was really aware of her relationship status and her status as a mother, it begs the question of how badly did she need this mommy makeover surgery? This is where people like me come in and tell you, just do your best. That's it. Now, obviously, when we're dealing with people who have lost a considerable amount of weight. We're talking hundreds of pounds, and they might need um, skin grafting and things of that nature bring to re-enhance their bodies back to what it would have been had they have been in shape the entire time. That's a different story. I understand that. I understand it completely. And even then, it is not an all-encompassing procedure. It is something that happens over time, not all at once. But from what I understand, a mommy makeover actually does the most. A mommy makeover can include the combination of the following: tummy tuck, breast augmentation, breast lift, liposuction, and vaginal rejuvenation surgery. Traditionally, the standard mommy makeover entails tummy tuck and breast augmentation, which means include any of the combination following. So we don't know what exactly full-on procedures that was being done. And personally, if I were the average person going to do this, or any person for that matter that's going to do this, I would do each of these surgeries on a separate time. I'm not going to go through all of this all at the same time, because it is such a shock to the body if you're going to go through all of this at the same time. Your body is you're really traumatizing your body when you go through a surgical procedure, especially when I can tell you with hip surgery, which is not the same but similar, you're being dug into with probes and prods and scissors and scalpels and all this other stuff to get you into the best possible condition that you can be in. Now, with that being said, like I said, I don't know, and nobody knows exactly what was being done and how much of a mom. Everybody knows that it was a mommy makeover because it was posted on her Instagram by her physician as well as herself. It was taken down off of Instagram, by the way. But the deal is that whatever your physical issues are, especially after having children, all we can do, and all that any man can ask you, the woman out there, can do, is simply take care of yourself the best way you can without having to go under the knife. We're losing far too many celebrities to this procedure. I'm if I'm not mistaken, Kanye West's mom was going through some sort of procedure when she passed away. Um, in this situation, she passed away. And what I wanted to go through with you guys is a plastic surgery mortality um, data, so that way you can understand what the mortality rate is. All right. So I'm going to share my screen with you. Abdominoplasty, which is basically dealing with abdominal manipulation. The mortality rate is 1 in 13,000. Buttock or augmentation grafting, 1 in 20. Fat grafting, 1 in 20,000, which is but this is not the full-on Brazilian butt lift. That is, we'll get to that later. Liposuction, 1.3 in 50,000. And there's no rate of death in facelifts nor breast lifts. Okay? Or it's not been recorded for facelifts and breast lifts. All right? This was in 2001. The mortality rate was 1 in 3,281 when lipoplasty was combined with abdominoplasty. So when you start combining procedures, your death rate actually increases. Survey studies tend to have inherited biases such as recall bias, participation bias, or subject bias. More accurate was a study by Keys et al. In 2017 that analyzed data over a 10-year period of time from the American Association of Accreditation of Ambulatory Surgery Facilities to evaluate the safe surgical practices in their accredited facilities, reported the VTE-related mortality rate between 1 in 10,082 and 1 in 13,106. Overall, outpatient surgery has been studied extensively and is safe. The rate of operative mortality associated with anesthesia and surgery in the outpatient setting, either in the operating room or in the post-anesthesia care unit, has been estimated to be 0.25 to 0.5 per 100,000 outpatient procedures. In addition, cosmetic surgeries performed in a hospital ambulatory surgery center or office-based surgical suite are all safe. Okay? Minor complications, major complications. Hematoma, infections, 1% in the hospital, 0.6 infections in the hospital. Ambulatory surgery center is equal, relatively equal. And then in office-based surgical suite, it's actually lower. All right. Rate of mortality is equal across the board. So nobody is doing it differently if you are running the same gambit. All right. I'm going to move on to the Brazilian butt lift. In July 2016, the Aesthetic Surgery Education and Research Foundation sent a gluteal fat grafting survey to all active members of the Aesthetic Society and International Society for Aesthetic Plastic Surgery, 4,843 questionnaires. A total of 692 surgeons responded. Number one, that means 4,000, almost 4,100 of them did not respond. 14.3 responded. On 198,857 cases, the survey asked members if they were aware of any BBL deaths, and from the answers estimated the mortality to be between 1 and 2,351 and 1 and 6,241, earning BBL's notoriety as the deadliest procedure in plastic surgery. This survey raised an alarm about BBL deaths, with many voices in plastic surgery asking if this procedure was too risky to perform. Media reports documented that in 2017, 5 deaths following BBLs had occurred in South Florida alone. The focus thus shifted to South Florida and as the suite with the highest number of BBL deaths in the United States, as the site, with the highest number of BBL deaths in the United States. The Miami-Dade medical examiner determined the cause of death for these patients to be PFE, which is the postmortem. PFE is, let's go back up real quick because we'll tell you what that is. PFE is pulmonary fat emboli, all right? The postmortem results confirmed a two-factor hypothesis for this fatal complication. Fat must be injected into the gluteal muscles and a gluteal vein injury must be present. These events can occur when fat is injected under the deep gluteal fascia into the gluteus maximus and when the fat grafting cannula inadvertently injures an intramuscular or submuscular gluteal vein. Guys, what you need to understand is that large muscles have a lot of veins in them. And if you start injecting fat directly into the muscle, what's going to happen is, or deep into the fascia, what's going to happen is that you're going to cut into a vein. You're going to cut a vein, and not only is it going to bleed out, but it's going to create a suction action as your heart beats, because the vein is supposed to pull things through into your lungs, into your heart, and into your brain. or through your brain. And when these things happen, you're putting fat into a situation to possibly block your veins. And since the veins don't have a natural pump flow, they have a double. So what you have to understand is that veins also have a one-way valve, right? So when fluid pushes through the vein, not the arteries, only the vein is unique to this. So when the vein opens up and pushes fluid through, and when the flow stops, it closes back, right? And it only closes back. It doesn't open up and fall back through. You cannot fall back through when it opens up, because everything is flowing in one direction. If you're familiar with plumbing, it's your I forget what it's called right now, but it's your stop valve, right? So if you have a stop valve on your piping, that's the thing that keeps water from backwashing back into your reservoir or back into the main line. The only way you can get water through is in and no way else, right? And the veins work the same exact way. It starts off, it has the little tiny A-frame shaped structures inside, and the fluid pushes through, and then it closes back. And if fat deposits are being suctioned into the vein, therefore what happens is that now you have that A-frame, it pushes in, fat goes in, pushes back out. Now what's happening is you're guaranteeing that that fat is sitting in that location. And if one of two things can happen, if you have fat pushed up against one of the A-frames, because obviously there's a wall here, there's a vein wall right here, in a venous wall right here. So if you're pushing, if the fat deposit breaks in between this space right here that I'm making with between the venous wall and the I forget what it's called, but it's a valve in the vein. Then now when fluid pushes through, look, it starts to get jammed. And if too much fat gets on both sides, now you're limiting your blood flow into the body. All right? You're limiting the blood flow back to the heart, number one, back to the lungs, number two. So that causes, and then it's a fatty deposit, so then it might get stuck and cause an embolism. All right? This is serious business, because you don't want these types of things to happen. All right? Fat pulmonary embolism. All right? Fat embolism is defined as the presence of fat globules in the pulmonary circulation. The term fat embolism syndrome refers to the clinical syndrome that follows an identifiable insult which releases fat into the circulation, resulting in pulmonary and systemic symptoms. Fat embolism syndrome is deadly between 5 and 20% of cases, with the death rate trending downward for several years now. The drop in death rate is largely due to preventative measures and better in-hospital monitoring for those at risk. All right. So what I'm going to do is I'm going to read this real quick. Fat embolism syndrome is most dangerous when it causes severe breathing problems or heart failure. The risk of developing either of these problems is highest when the condition is severe or when there are delays in treatment. All right, this is from the Cleveland Clinic itself. But guys, this is me landing the plane. I'm getting ready to land the plane, guys, so bear with me. Guys, you have spouses, you have loved ones who are of the female persuasion. So like I said, since only about 8 women actually watch this channel, fellas, it is incumbent upon you to share your feelings about doing these procedures and how dangerous it really is. I genuinely wish that you guys would rather pay for personal training. It would obviously doesn't have to be with me because I could only train with so many people. But what I will say is that I do hope that you in the future will seek out a personal trainer, a competent one, of course, a licensed one, of course, or a certified one, of course. And in that process, you guys will be able to work through some of the physical issues that you are suffering from when your spouses have your children. Or if you are female yourself, you having these children yourself. It is important that you guys truly do love the bodies that you have. Yes, your bodies will go through some things having children. However, it is not worth your life. I am pretty sure, 99.999 million% sure, that DC Young Fly would rather his wife or his spouse or his partner not do this procedure and be there with him looking the way she looks than to have her go through this procedure and leave him. This is where the hard work comes in. Ladies and gentlemen, you need to do the hard work. It is the only way. It is, I shouldn't say it's the only way. There's the easy way, obviously, but it's the only way that will benefit you in the long run. I genuinely want you guys to push yourselves and be the best you, because somebody is always going to meet you for the first time. And when they meet you for the first time, it'd be more than likely at your worst. So if it is going to be the worst version of yourselves, let it be the best version of yourself. So guys, thank you for staying with me this long. Don't forget to like, subscribe, share, follow me on Facebook, Instagram, and on YouTube. God bless you, Miss Jacky O. God bless you, DC Young Fly, and your 3 beautiful children. Have a nice day, and be the best you.